Hello, and welcome to Module 4, Kidney Donation Surgery. This module covers the surgical procedure, our hospital procedures, and how postoperative pain is controlled. Once you have been cleared to proceed with kidney donation, the Living Kidney Donation team will work with you to book a surgery date. It is important for you to know that surgery can only be booked if you are cleared for donation and your recipient is also cleared to proceed with transplantation. The hospital staff will try and accommodate you and your recipient as much as possible to find a suitable surgery date. Typically, surgery dates are confirmed about 1 month ahead of time. It is also important to know that health problems in the living kidney donor or recipient may occur prior to surgery. In these cases, extra testing may be needed before surgery, or the surgery may be cancelled or postponed. Approximately 1 to 3 weeks before your surgery, you will be required to complete basic blood and urine tests and attend appointments with a surgeon, clinical coordinator, and anesthesiologist. These must all be completed at Toronto General Hospital. If you live far away from Toronto General Hospital, the Living Kidney Donation team can direct you to local accommodations such as local hotels that offer a discounted rate for Toronto General Hospital patients. In the month before your surgery, it is important to take extra precautions to prevent getting an infection that can affect your health and the health of the recipient. Infections can sometimes be transmitted from the donor to the recipient when a transplant occurs, which is why we recommend extra precautions prior to surgery. These precautions include practicing safe sex, avoiding mosquito and bug bites, avoiding using needles, including needles for electrolysis or acupuncture, avoiding getting tattoos or piercings, and avoiding travel outside of North America. In addition, alcohol should be avoided 24 hours prior to surgery. On the morning of your surgery, you will be admitted to the hospital around 6 a.m. Following your surgery, you will be in the Post-Anesthesia Care Unit, PACU, or recovery room for about 2 to 4 hours, and then you will be admitted to the 6th, 7th, or 10th floor of the Peter Munk Building for recovery. Kidney donation surgery, also called nephrectomy, is performed laparoscopically, which is a minimally invasive procedure where 3 or 4 very small cuts, approximately ½ an inch each, are made in the upper right or upper left part of your stomach to allow the insertion of a small camera and surgical instruments. The small camera is used to monitor the procedure. The surgical instruments are used to separate the kidney from your body for it to be removed. Then, an approximately 4-inch incision is made in the lower part of your stomach to remove the kidney out of your body. The incisions are closed using sutures, and the skin is closed using small pieces of surgical tape. The surgery takes about 3.5 hours. After surgery, you will stay in the hospital for approximately 3 to 5 days. You will have a urinary catheter, which is a tube that is inserted into your bladder to drain the urine for about 1 to 2 days. Your sutures will dissolve on their own in about 2 weeks. Right after your surgery, there will be some pain and discomfort around the site of your incision. You will be given medications to lessen the pain. Your pain will be managed by patient-controlled analgesia, PCA, and oral pain medication. PCA is started before you go to the Post-Anesthesia Care Unit or recovery room and is stopped when you are ready to take pain medication by mouth. The incision will become less painful over the first couple of weeks, but it will take several weeks for the muscles and nerves to heal completely. Analgesia is medicine for pain. PCA allows you to give yourself pain medicine by pushing a button. you will have an intravenous IV catheter in your hand or arm. The PCA pump is connected to your IV. When you push the button, the pump will give you the pain medicine through your IV. The medicine will take 5 to 10 minutes to work. To prevent overdose, the PCA pump has a safety timer called a lockout. The lockout time is typically 5 to 10 minutes. If you press the button during the lockout time, you will not receive more medicine. This is to ensure that a safe amount of pain medicine is delivered to you during your recovery. There are some important things you should know about PCA. Visitors and families should not press the PCA button. Only you should push the button. Do not wait until the pain is severe before using your pain medicine. Push the button when you start to feel pain. You can also push the button before you do something that brings on pain, such as movement or coughing. Do not use PCA for gas or bowel pain. Do not use PCA when you are comfortable or sleepy. There are some side effects to PCA. The most common side effects of PCA are nausea or vomiting, sleepiness, itchiness, difficulty emptying your bladder after removal of your catheter, constipation, and hallucinations. You will be monitored for these side effects. PCA will be stopped when you are able to take pain medicine by mouth. Your surgeon will decide when it is safe to be discharged home to recover. This will depend on your level of pain, your ability to eat and drink, as well as your bowel and bladder function. When you are ready to be discharged home, you will be given a prescription for pain medication, for example Percocet or Tylenol 3, and stool softeners. Narcotics, such as Percocet or Tylenol 3, can make you drowsy and cause constipation. Drinking fluids, eating fruits and vegetables, and using stool softeners can help with regular bowel movements. If you wish, you may take extra-strength Tylenol as per package instructions instead of the narcotic pain medication prescribed. Many living donors only require Tylenol at home for pain while they recover. Here are some important points to keep in mind for recovering after surgery. Most living kidney donors require 4 to 6 weeks off before getting back to work. Avoid driving while taking narcotic pain medication. You should also avoid driving if you have pain over your incisions, as your range of motion may be limited. This may affect your ability to properly check your blind spots while driving, and you may have pain while your seatbelt is fastened. Avoid pregnancy for 6 months after donation. If you plan on becoming pregnant after donation, you should discuss this with the nephrologist prior to donation surgery. You should avoid non-steroidal anti-inflammatories such as Advil, Motrin, ibuprofen, Aleve, and naproxen after kidney donation for the rest of your life. Tylenol is safe to use. You should not do any heavy lifting over 10 pounds or intense physical activity for at least 6 weeks after surgery. Heavy lifting may damage your incision and can affect your healing. This may also cause a hernia at the site of your incision, which would require further surgery to treat. Walking is the best exercise while you recover from surgery. You should try to walk a bit every day and to increase the distance and speed you walk each day based on how you feel. In the winter, you can walk in malls to avoid icy surfaces and cold conditions, or use a treadmill if you have access to one. You may resume sexual activity as soon as you feel ready to do so. Small steri strips are placed on the incisions to provide some support. There are no sutures or staples to remove. The steri strips will fall off on their own. It is good to have a shower daily and to let the water flow over the incision. Gently dry the incision with a clean towel. Do not soak in the bath or go swimming until the incision is completely healed. Do not use a heating pad over the incision. You have now completed Module 4, Kidney Donation Surgery. In this module, we reviewed preoperative considerations of kidney donation surgery, the laparoscopic nephrectomy procedure, postoperative considerations, pain management, and finally, recovery after surgery. In the next module, we will review life post-donation.